patient can have a biopsy done, the slides can be scanned, and can be transmitted for diagnosis. As you may or may not be aware, cancer diagnosis requires 2 reviews in order to confirm that diagnosis. So for many communities, through telemedicine, we are able to provide that second review. You have a community, a small community, there's one pathologist. The pathologist is really not able to, in a quality assurance manner, lend that diagnosis of cancer without that second review. We're able to help support that person by providing that second review. And we've actually published a series on telepathology QA for that format. As far as management of cancer, again, some of this could be done within the patient's home. Some of this would require, for example, going to a chapter house to have an assessment. But for example, in the patient's home, again, working with the community health worker, and even the patient may have, there are desktop models that can sit in the patient's home where the patient, and we've done this with bone marrow transplant patients. Patients are in the home, patients send in their vital signs, send in images of their mouth, are able to transmit clinical data on their own, from their own home. So there's that possibility. There's, again, possibility for education for cancer clinical trials. And then if there is a situation where the person is needing chemotherapy, where the person is needing radiation, again, depending on where the patient is, if there's a chemo-certified nurse locally and the patient is receiving standard chemotherapy, there's certainly the possibility of doing the provision of the chemotherapy in an area that's more local to the patient than having the patient travel to, let's say, the Arizona Cancer Center. So I think there are multiple ways where the system, in the broad sense, the network, where this form of technology can be used to help support patient care, patients with cancer, everywhere from diagnosis to, prevention, diagnosis, treatment, and certainly through the survivorship phase of long-term follow-up. Who don't know me, they would think, oh, you must be a real computer geek. You know, I have trouble with Outlook, with my email at times. It's not that I'm a computer geek, but I really want to improve access to care to people. So I would love to work with you to see how we could reach the folks that you're trying to serve.
I think that's a really important kind of conclusion in a sense, because we're not going to be able to resolve all the unique problems and challenges. But I would love it, Pete, if you do follow up with Dr. Lopez and you set up a time and an opportunity to talk about that and hopefully be able to develop a model that will, again, meet the needs of some, particular kinds of not only communities, but we're talking about tobacco use, and we know that that's a prevalent issue, for many people, but certainly we were talking about your statistics, about the number of young people, and see about using it creatively. In terms of young people, something like this could have probably more impact than our more traditional ways of reaching out and trying to educate people about the dangers of tobacco. The young people, by the way, most of them are so much more confident than we are. When I say we, I mean people of our generation. So that might be actually a way of attracting them and maybe training them to go out and do, outreach to other people. Because, again, they can handle all this. And it may be a way to interest them and excite them. I know I can get my grandkids to do anything if I let them use the computer. Okay, you have to do this and this, you have to do your homework, as long as, I give them a little time to do their little game. So what I'm saying is that we can get really creative, so please, Pete, use this as an opportunity to say, okay, let's see how this could possibly work.
And I think that was my next point was, I think our people are ready for this. I know that prevention education is really needed out on throughout the Navajo Nation. You know, we don't want them to come in here, you know, to the hospital. You know, we're trying to prevent that from happening, and we feel like when it gets, usually when it gets to this point, it's usually, you know, the diagnosis. You know, but you know, as prevention educators, you know, health advocates, I know of a couple of situations within the last month. You know that, you know, if the people had only known early on that, you know, certain things, certain cancers or certain type of flu type, something could have been avoided. You know, I'm not sure, but you know, I just really believe that. I sat in a conference with the Navajo Nation Division of Health about a week ago, and they were talking about the H1N1 is just an example. You know, even though it's been reported on the Navajo Nation and reported in certain areas, that, you know, one of the things was the lack of information that was being disseminated. Sure, you know, in these hospitals, yeah, it is, you know, the information is being disseminated, but as far as this information getting out to the people out in the rural area, they still are not getting the information that they should be, that the community should be sending out. And I think, you know, that was one of the concerns of our local leader, is that, you know, not enough information like this is getting out to the community that really needs it. And you know, like I said, it's usually until it's too late, or you know, until, you know, a person feels sick that the information is getting out. But you know, there is that preventive part of it, and I'm really intrigued by this network.
I'd just like to, if I may, to put something on that, just to put into the mix, because I think this is a very interesting conversation, and I think, you know, through what Anna Maria and people like her are doing, there are extraordinary opportunities. But a thing that bothers me, not just me, but I think that should bother us all, is that we function far too much in silos. So, and the way that a lot of this kind of is driven is that I write grants for a living. I mean, that's how I pay most of my salary. So, you know, there's a new technology, or we'd like to do something for breast and cervix, or we'd like to do something for colon, or we'd like to do something for diabetes. Well, in fact, there's a lot of what we would like to do in all of those areas that has a great commonality to it. So if you look at the common diseases, whether they're malignant or non-malignant, then lifestyle factors, obviously tobacco, but lifestyle in general, have to do with about 90% of the causality of a lot of these conditions. One of these, I think one of the major problems that we have is that we're not actually getting together under one umbrella and getting the word out that if we get our kids eating sensible diets and taking exercise and all of these boring things now, then 30, 40 years down the road and not smoking, there will be less breast cancer, there will be less prostate cancer, there will be less colon cancer. And so I think actually that using this technology somehow or other to get people under the same umbrella is an incredibly important idea, so that we don't, you know, we all come to meetings like this and we hear of all this fantastic stuff that's going on that we didn't know about. Now, we're never going to know everything about everything, but I think we have technology available that can actually really get us much better connected, so that we have huge efficiencies and we actually save money for the country as well as save lives.
Based on that, my son, he got one of those iPhones. He was able to get Sirius Radio on his computer and on his iPhone, and he plugged it into my radio in my car, and without paying, we were listening.
We all want to know how to do that.
Yeah, I get serious and I pay.
And I said, do you have a plan with Sirius Radio? And he told me no. I was just able to, through my computer.
We probably should turn off the right now. We're not going to get things like, Pete, that to me is one of the most important things that adds on to what Dr. Lance just said. I think we have opportunities, and I often make this comment, when I start out, I say, I'm going to help people with myeloma. Well, I had to just say, that's ridiculous. I have to help people, and I'm focusing mostly on cancer, but I call it the body part syndrome, Dr. Lopez, where it's cancer of the breast, it's cancer of the cervical, it's lung cancer, it's cancer.